Hello and welcome to the SOFEA Sessions podcast. In today's shorthand episode, Kerry Lock, who is SOFEA's nutritional therapist and Nourish and Flourish programme lead, talks about how the Nourish and Flourish programme addresses three key issues. First of all, the rising childhood obesity rates. Since 2006, childhood obesity rates have increased by 30% nationally, and in Didcot alone by 40%. Secondly, rising chronic disease in adults, and thirdly, barriers to healthy eating. Hello, Kerry.
Hi, Nikki.
Welcome to the SOFEA Sessions shorthand episode.
Excited to be here.
Good. Thank you for coming on. I think it's been a great opportunity to talk about the programmes that you're running and dig into them a little bit more deeply.
Absolutely.
So should we start by you introducing yourself to the listeners and maybe talking a little bit about what you do?
Sure. So my name's Kerry Lock and I'm the Nourish and Flourish Programme Manager and Nutritional Therapist here at SOFEA.
Amazing. How long have you been at SOFEA now?
Goodness, come September, it'll be 4 years.
Wow.
4 wonderful years.
Okay. Let's start with talking a little bit about Nourish and Flourish then. I think we use this model a lot, but we always say start with why. So why does Nourish and Flourish exist?
Wow, so there's several layers to the why for Nourish and Flourish. First and foremost, it's to tackle the rising childhood obesity issue. So national stats, childhood obesity between 10 to 11-year-olds is up 30% since 2006. And locally here in Didcot in the southeast, the obesity rate is up to 41.4% for the year 6 of children. The challenges at that will transpose into higher rates of chronic disease into the future. So that is one of the first elements. We'll come back to what we're doing about that. But and then the second why is tackling rising chronic disease in the adults. So type 2 diabetes is up 22% in the under 25-year-olds in the last 5 years of national data. That's quite a shocking statistic. Yeah. All of these statistics are absolutely horrendous, and so we really wanted to try and strive to make a shift change towards that. The third issue is tackling extensive barriers to healthy eating. That looks like lack of vital cooking skills, affordable access to healthy food options. We talk about the food environment, so that really encompasses the availability and affordability, and I'll probably use that term a bit later on. And then also cooking equipment needs as well can be a real barrier. So as you can see, we've got all of these different layers that we're looking to tackle. It's been really made clear that from the British Journal of Nutrition that what we eat has become now the biggest risk factor regarding preventable diseases. So 56% of calories eaten by older children, so 11 plus and adults, is coming from ultra-processed foods. Gosh. So this is a real challenge within the sector to help provide support.
Absolutely. And actually just hearing you kind of talk about that, it is the access part that stands out for me in terms of the reason why people aren't able to get, the support they need or are struggling with these health issues. A lot of it is down to poverty, isn't it? And not being able to access. Yeah,
it's there are a lot of scary statistics around the inequality around all of the elements I've just described. Children in the most deprived fifth of the population are over twice as likely to be living with obesity by the time they hit their first year of school. Gosh. Compared to the least deprived fifth within the population. And thinking about that affordable access to healthy foods option, the most deprived fifth of the population would need to spend about 50% of their disposable income to be able to meet the cost of the NHS Eat Well plate, the ideal kind of nutritional balance across the day, compared to 11% of the income for the least deprived fifth. These are really stark figures. We as an organisation can help do something about it.
Absolutely.
When I proposed the Nourish and Flourish programme to our lovely CEO Richard, and I said I've got no funding, but this is what I would love to do. And then he introduced me to the amazing GP Rachel Ward up at the Didcot PCN, who was absolutely on the same wavelength. We'd really been independently having these similar thought processes, and they came together at exactly the right time. So So we launched Nourish and Flourish in collaboration with the Didcot Primary Care Network in January 2022. And then, fantastic, just to go, well, these are the reasons why. We just need to start the process. The how came about really from initially listening to the local community. I first stepped into one of our local larders, the Didcot larder, and just started exploring with people like how they would like to utilise nutritional therapists, what kind of barriers they were facing with access to sort of healthy eating, building up a bit of a picture that way. And then through the PCN network, we were able to push out a questionnaire to all of the patients here in Didcot, which is well over 30,000 people. It's enormous. Yeah. I was able to have one-to-one conversations with people in the larder as well, and that was incredible. And I went in and did some really informal cooking, like pop-up sessions and chatting to people. There were two key elements that came back from that. One was that people wanted one-to-one nutritional support. The second was that they wanted access to cooking skills. And that came back through both of those threads, really, which was really reassuring that we'd kind of paired that information. Building upon this collaboration with the Didcot PCN, and then in discussions with like other organisations and councils, we were able to just make sure like, well, what other existing services are there, so that the model that we were building was complementing existing services and programs. And fundamentally it was building upon sort of an evidence-based approach as well. So tailored to the local community needs, we were able then to start building the what.
You have had such an assets-based approach, and that started with the community voice, and I think for any project that's essential, isn't it?
Absolutely, 100%, because we wanted to make sure that we were building something that was set against what the need was, to be able to have real tangible changes that we could offer. Food is a vital part of all of our lives, fuels our bodies and minds, and it acts as like a social linchpin as well, which I love, really sort of building relations, whether that's within families or the community. So talking about the nutritional needs, having an understanding of what we need is really crucial to our long-term health. So the what was really incorporating all of those elements and building upon what the public had needed. Of course, because we have our partnership with the PCN, there was a lot of data we were able to filter down through Rachel Ward, who I'd mentioned. So she is the health inequalities and social prescribing lead. It's worth pointing out at the Didcot PCN, and a major friend and collaborator of all of ours, which is wonderful. So in terms of the what, it's effectively we've evolved three key areas. The first was launched in 2022, and effectively it's working with the local primary schools. So this is thinking about preventative work. So thinking about the childhood obesity element, what I did is I embedded nutrition into the core curriculum. So for geography, maths, biology and history. Really effectively developed like the lesson plans, all the slide decks, built all the resources for the schools, for the teachers. Into that built parent engagement sessions, so we could really use our amazing whole system approach at SOFEA and wrap that around. So social prescribers, bringing them on board. Again, that's another collaboration with the PCN, and also incorporating other partners like the UMove officers through the council, and having an activity component to the programme. Then I built in also working with Replenish, that's like a local project that's out of the Community Action Group Oxygen Network. It's all about reducing food waste, so we were able to build in like a growing and composting element into the programme, like actual outdoor activities.
That's great.
And then fundamentally there was the cooking component as well, so using here at SOFEA, obviously we have the food surplus network that we link in with FareShare, so we were able to use some of that food surplus and actually have cooking sessions. So it wasn't using recipes, it was about teaching these young people how to cook with whatever you have, which is really powerful. And I was very lucky in that first year. We worked with 3 primary schools, 180 10-year-olds.
Wow.
And I had the fab fun of working with all of them and teaching 180 10-year-olds how to cook with surplus food. It was just like the best fun.
I can imagine that was really great.
And it's with thanks to the Didcot Girls' School and St. Brianus, who enabled me to have access to their food labs. And that was a lovely link up as well, because that gave those young people an opportunity to see the high school. We had some of the older students volunteering in the sessions, so they were able to sort of ask their sort of peers some questions as well. So that was the first year. Then we were able to the feedback from that, both from the children, from the parents, from the schools, was overwhelming. It was absolutely incredible. 98% in that first year said they wanted all their peers to experience the programme. They absolutely loved it. They were going to eat all their 5 a day. It was just absolutely incredible, really, really powerful. And, over 50% of children had tried new fruits and veg for the first time. And it was really powerful. And then from that data, we were able to work with the local council, and the Didcot Garden Town then funded the second year rollout, so 2023. That encompassed 8 schools and 455 students.
Wow.
So it was whole next level. So I brought on board some community chefs. A lovely Vanessa and Maya came on board in the Nourish Flourish programme. Again, enormous success with the support from Replenish and New Move as well. And the feedback's fantastic. And I'm actually putting together the impact report of the first 2 years at the moment. So we will release that on social media in due course so people can see that story bundled together. But it's with enormous thanks to all of those schools that became involved, because without their input, it was very much co-evolved with their support after that initial pilot and the pilot expansion. So that's fantastic. So that's the school programme in a nutshell. Then we have the nutritional therapy clinic, so the Nourish Flourish Nutritional Therapy Clinic, and in that I am able to run one-to-one support sessions for patients that are referred from the GPs, from the diabetic nurses, and from the social prescribers, which is absolutely fantastic. And I'm really lucky I get a whole hour with patients in that first instance, which is wonderful.
So great,
do an initial call, have an initial sort of 10-minute chat, and then we book in our first face-to-face session. And depending on what their need is, we can book in future sessions as well. The feedback from those sessions has been fantastic. And of course, it's built upon right from the request from the public themselves. Absolutely. So I work with a huge range of patients. My youngest is 4.5 and the eldest is 89 currently.
Wow,
so
that's a real
you can imagine a
age.
real diverse spectrum of need there as well. So from some young people maybe with experiencing autism that are not eating a broad enough spectrum of food, and how to support them, right through to some elderly patients that are suffering from type 2 diabetic, type 2 diabetes, and other chronic diseases, or maybe sort of high cholesterol, non-alcoholic fatty liver disease, etc. It's very, very broad ranging, such a rewarding element to the role.
And actually great that you can see, I guess, the vastness of need within the community, right from that younger age right up to more elderly people.
Absolutely. Yeah.
So your Nourish and Flourish clinics, how does that link to the PCN? And you mentioned Dr. Rachel Ward earlier.
Yeah, sure. So Rachel, I work in parallel with, across the whole programme. With the clinic, very much the social prescribers, we work in partnership. At times, some patients will come through that have whole complex series of needs, and it's not just about nutritional support that they need. They will need the social prescribing support to link them up with other services. So sometimes I'll maybe refer to the social prescriber first, then they'll come back to me. Sometimes, depending on that person's circumstances, we will be able to work in parallel. Great synergy, working with the GPs like Rachel and the social prescribers, which is fantastic. So we have the Nourish and Flourish Community Kitchen, which after we completed the school programme in Term 6 last year, then we launched into building the community kitchen here at SOFEA in Wani, in the community hub. So this has been a long-term aspiration of both Richard and Ruth here at SOFEA, to have a kitchen which could support and feed our young people. Fitted in brilliantly with the Nourish Flourish programme. We were very lucky to have a great collaboration of a build team. So from one of our very own volunteers, Chris, who helped support the table tennis programme, he was also happens to be a builder. So it was absolutely fantastic to have him within the fold already, and for him to really understand what the need was. And then along with our amazing chef, Alex Mackay, who has been on one of your podcasts before, which is brilliant. So you've heard his lively voice and his energy. And we were able to really co-create that space with Alex, with his knowledge and creating all the cooking flows. And then amazing contacts we have up at the JR Hospital, I was able to go and rip out an old Costa coffee in an old canteen, and we've tried to upcycle as much as we possibly can, and links with like JSK restaurants. We were able to access like loads of crockery and things as well. It's been amazing, some of the resources we've been able to pull together for that. So that was a real labour of love last summer, like pretty much camping out here.
Yeah, you spent a lot of time.
It was absolutely, but it was so much fun and a real interesting learning curve. And then fantastically we had Brendan on board from Object Space Place, who were absolutely incredible in offering their time for free to design this kitchen according to what Alex's needs were as the chef. And they were absolutely brilliant. So they're based in London. They've been absolutely brilliant and supportive all the way through the project. Brendan has been very giving with his time. It's absolutely brilliant. Then we worked towards the launch. So we managed to open at the beginning of November, and the first students went in at the very beginning of November. And that was really emotional.
I can imagine.
For so many of us,
Yeah.
just to see the first students going in with Alex, and they're going in sort of under the guise of their English and maths, basically. So we're building it into the education programme. But of course, being mentored by someone like Alex with 30 years experience is absolutely phenomenal. He has an incredible legacy. And one of the students has already bounced on to an apprenticeship, of course, which is absolutely amazing. Within that sort of first session, that was incredible. The students responded really well to Alex, and he is able to work really quite fluidly with them, responding to their needs. Obviously, we have a huge spectrum of needs within the students, and he has enormous patience in working through what their needs are and giving them that support, as we all do as a kind of a wraparound team. But what's lovely is the kitchen gives those students a purpose. So on a Tuesday, they do a prep day with Alex, and then they're serving out the main meal on the Wednesday, and they're serving out to all of their peers.
Yeah, which is amazing.
Which is absolutely incredible, and to the volunteers and staff as well. And we're all able to sit down for a meal together, which is really, really special. And I think, again, coming back to that element of food being a linchpin and building communities and connections, there are many individuals for whom they haven't sat down for a meal before, so this is really quite special.
That's a real connector.
Real massive connector, absolutely. And then there is a pop-up omelette station they do on the Tuesday as well for their peers, which is absolutely fantastic. And then enough food is created on the Wednesday that we're able to give those students additional food to be able to support them through the rest of the week as well as they need, which is absolutely fantastic. The other element that we've explored is we gained South and Vale funding last year, pulled together a community cooking coalition with fabulous partners like May Messy and Style Acre and One Planet, Abingdon and Down to Earth. We were able to roll out a whole series of community cooking sessions, and that was absolutely phenomenal. We did that in February and March this year. Again, that's building upon what the ask from the general public was. They wanted to build their basic skills, and again we went away from recipes, and it was about just using what was available. So they learned how to make a basic bolognese sauce, a lentil bolognese. They learned how to make a risotto. They learned how to make a curry from scratch. And then through discussion in real time with each of the groups, we were making sort of like fresh dips, like salsas and guacamole, and to make an omelette as well, which is a really good, straightforward meal that you can augment with amazing extras and various veggies and such. That was really fantastic. In a whole, we were in partnership with Secret Santa 365, so they were fantastic in giving us some lovely utensils as well to give away for free. And I built into that grant the ability to give a slow cooker to each of the attendees as well, because obviously that's a really great way of kind of cooking quite easily, but being able to cook like lovely nutritious food. And more will come out on social media about that as well. We've got some more lovely photos to share from that experience. Loads more things that we're going to be doing into the future with the kitchen, but the key aspiration has been providing this kind of education opportunity for our young people. They're learning their core vital cooking skills themselves. They've gone from zero to making focaccia, like all these incredible like meals, really complex meals under the sort of guise of Alex. But they're doing the graft, which is
it's amazing to watch as well. Like you say, it's just such a lovely experience to watch. Young people thriving in an environment that's so supportive, and they can see the outcome. They can see the tangible outcomes for it, and sharing, with peers and the rest of the SOFEA community is it's amazing.
Brilliant, and it's using food surplus.
Yeah.
So it's sort of building in that element of environmental benefits as well, which is fantastic.
So there's so much that Nourish and Flourish is doing. It really is all linked back to community need and community voice, and I think, and food surplus and sustainability, which is just amazing and just lovely to see it evolve.
Yeah, we launched January 2022 we launched. So relatively speaking, it's only 2.5 years.
Yeah. And so much has happened in that time.
So much has happened. But the first key remit was really like to evolve free nutritional support opportunities. But at the early stages, it was like, well, we don't know what they're going to look like. We're going to speak to the general public. And it's amazing that now we've got these 3 key areas that we're evolving.
Absolutely.
Continuing to evolve.
So thinking about those 3 key pillars, how can people get involved, access support from the Nourish and Flourish various programmes?
Yeah, so with the clinic, obviously if they feel that they need nutritional therapy support, they can get a referral through their GP, or if they have type 2 diabetes, then they can get a referral from the diabetic nurse. Or if they are getting support from the social prescriber, or they can reach out to the social prescriber and get a referral through them as well.
Okay, fantastic.
And perhaps you could pop the link for the social prescribing.
Yes, all the links will be mentioned.
That'll be amazing.
Yeah, in the description below.
Absolutely.
Fantastic.
And then with the school programme at the moment, obviously we're having lots of positive conversations about funding into the future. So I hope that we will be able to make announcements in the coming near future. Any school, obviously we started off as a pilot in Didcot predominantly, just to start exploring and testing the model. But if people have any questions or interested potentially involved in the future, that would be brilliant. If they can just get in contact with me, because that's useful to have that kind of stored, if you like, just to have that on the radar, really. And regarding the community kitchen, I am building a waiting list for the community cooking sessions. So obviously that was a block funding from the Food and Warmth grant that we won sort of last autumn into this year. But I am building a waiting list. So if people feel that they would benefit from community cooking sessions, then I want them to feel like they are able to get directly in contact with me as well.
Okay.
So, and then I can add that to the waiting list, because again, as soon as we're able to unlock more funding for that, we'll be able to roll out more blocks. So although we don't currently have more funding, it's just really good for us to be able to show the demand and the need moving forward. And I hope that we'll be able to get another block rolled out as soon as possible. Into the future, the next kind of key elements to roll out of the kitchen, Alex and I are really keen to roll out nutritional therapy cooking sessions. So that would look like sub cohorts of my patients effectively, so say the type 2 diabetics or people with high cholesterol, and do a cooking session with them and then do some peer-to-peer work.
Brilliant.
Again, we're just exploring funding opportunities for that, but hope to be able to share happy news further into the year. And then we're exploring opportunities around social enterprises and developing that. So thinking about our employability program and our young people, and how we can roll out a social enterprise which could be producing food that we would be able to sell very, very cheaply. We would be able to tick many of the boxes regarding affordability of healthy food. That would be absolutely brilliant. But again, we're just exploring the funding opportunities around that. So watch this space.
Amazing.
So I've got a business student starting very soon to be able to start working on that, which would be fantastic. And then longer term, we hope to roll out our own apprenticeship, because obviously we've got the SOFEA pre-apprentice programme, exploring with that new team member what opportunities we could offer directly from the kitchen itself as well. So lots of things, lots of new exciting elements in the fire, and lots of other organisations that we want to collaborate with around other opportunities like the Holiday Activities Fund and that kind of thing. There's lots of potential around that as we move forward into the future, but initially sort of launching the kitchen and getting those processes and everything in place. And obviously we were very delighted to have the King and Queen come and open the kitchen officially. That was incredible. When King Charles was launching the food coronation programme, it was amazing that they, at the time, we just said, would you mind?
Yeah, it was amazing.
opening the kitchen. Well. What was most important was the young people that were in the kitchen and how special that was,
it was really
for
special.
them, and just to show what they can do and what they can achieve. It's really,
all
really
the amazing
special.
work that it's enabling them to do and get stuck into. It's incredible. Well, thank you so much for coming on to the SOFEA Sessions Shorthand. It's nice to have you.
Absolute pleasure.
I'll be intrigued and looking forward to the impact report. Like I said, all the links to the support support and how to get in contact I'll put in the description. And again, a massive thank you to all the partners that have been involved in the process. It really is a beautiful beast of a programme, isn't it? And
it's been a
helping
massive team effort.
many people.
Yeah, absolutely. And I can't wait to come back and give more updates.
Amazing. Great.
Lovely.
Look forward to it.
Vicky.
Thank you, Kerry. A huge thanks to Kerry for coming onto the SOFEA Sessions podcast today. If you're interested in getting in touch or to access this free support, all the links are in the description below. If you're looking to access the nutritional support, you can do this via your Didcot GP, a diabetic nurse, or you can self-refer to one of our social prescribers. The easiest way to do that is to visit our website, or you can email us at wellbeing@sophia.uk.com. Please do like, share and subscribe, and if you want to support any of the work that SOFEA does, whether that be donation, volunteering or collaboration, please do visit our website www.sophia.uk.com.